Hello, my name's Janet and I'm part of the Hampshire Eating Disorder Service. This video will share some information about the treatment that you will receive as part of the Hampshire Eating Disorder team. We use something called the family-based treatment model, and this is based on some work that has been done by the Maudsley Hospital in London. The evidence is that this is the best treatment approach for anorexia and bulimia to some extent, but it actually uses the skills and resources of all the family to support the young person as they go through their treatment. And again, that might sound a bit bonkers. But again, if we stop and think that when you come into the clinic, you come in for 1 hour, maybe every week, and there's still 23 hours of that day, and there are still another 6 days of that week for you and your family to be able to support your young person who's struggling and is very poorly. So it's important to really understand some of the principles behind the treatment approach. I think one key factor is you, parent and carers of your child. You are the experts in your child. The clinicians have years of experience in helping and supporting families with eating disorders and have participated in numerous hours of training with this family-based treatment approach. So I think it's really important to look at this as a collaborative approach where you understand your child and the clinicians understand the guidelines that give the best evidence in terms of the outcomes of treating eating disorders. So that in itself is a huge ask for families. But we know that families can do this, and we know that with the right support and information, you as a family will be able to do this. So the structure to the treatment is actually in 4 phases, and I'm not going to spend much time talking about those 4 phases. But in essence, what it is getting your child from the poorly state that they may well be in, being undernourished, back through to being independent and being able to live a healthy and independent life. So the first phase talks about refeeding, and that is actually getting the child back to having the nutrition that's required for their particular age and stage of development. So each child is unique. So let's look at some of the principles of the family-based treatment approach. One of the key principles is to keep calm, be consistent, love unconditionally, and communicate. 4 really simple words, but my gosh, do they take some doing. I think the calmness, when tempers are being raised, the Coke bottle that you might have seen in a previous video, it's really hard to stay calm. But I think it's really important that maybe you think this is what I need to do to care for my child. So one of the things that the clinicians may well talk about is the ability to separate your child from the eating disorder. So your child, your Chloe, your Fred, your Annabelle, your Ben is still there, but they've got a bully inside their head. And it's that bully that is making them behave in ways that you haven't seen before. It's that bully that's making them display all sorts of emotions that you've never seen before. And so you still need to parent your child, but you need to care for the eating disorder. And this is something called externalization. Some families will give the bully, the eating disorder, a voice. Some families that doesn't work. But again, it's something to consider, because as a parent or carer, it might make it easier for you to understand that, are you dealing with your child, or are you dealing with the eating disorder? And you can parent your child with love, affection, and cuddles. But actually, when you're caring for the eating disorder, you may well be in a situation where you need for this meal to be completed, because food is medicine for someone with an eating disorder. So when a meal needs to be completed, it's more about the positive intent, that consistency, that actually this meal will be eaten. Think about when your child was maybe a toddler and they would be sitting at the table and you would prepare a meal and put it in front of them. It may be, I think I can remember that I had food on the floor, we might have had spitting, we might have had refusal. But actually when children were 4, you would actually say, no, this isn't the way that we behave. And actually, if food got thrown on the floor, you would replace it. If food was spat out, you would say, no, this isn't not the way we behave. We don't spit food out. So I'm using this as a way of encouraging you that you have the skills to use at the mealtime when you are maybe faced with a 14-year-old that is not behaving as you would expect. Because if you remember, their heads are full of anxiety, this overrating fear of possibly getting fat, and that the food in front of them might even, if you think about, I'm a celebrity, get me out of here. When the celebrities do a bush tucker trial, and it may well be a plate of something quite horrendous, it may well be that for your child, that plate of food that you know is absolutely the right thing for them, it may well be for them, it's the equivalent of a bush tucker trial. So if you can try and think about that, it's about trying to encourage your child to eat, to try and lessen their anxiety. And there are numerous ways of doing that, but distraction is a really great strategy. And that can be the television being on, the radio being on, talking about holidays, having photographs of when they were a baby, and card games, anything like that. But it's about reducing their focus on the anxiety that they have in finishing this meal. It's not easy. For some young people, eating is not the problem once they get started. For some, it's actually just picking up the fork to start off with. I have said before, your child is unique, and how they may well react to the bully inside them is very differs from child to child. So going back to you as a family, that compassion, that understanding, that trying to think about what your child might be going through is really important. Another thing that's really important is structure and boundaries. It's really easy to, given that your child is very poorly, to think, oh no, I can't challenge that, or I can't mention that, because I don't want to make things worse. And you can end up walking on eggshells. And then the whole family, the anxiety level just gets worse. So I think it's really important to have boundaries, to have structure, and to have routine, because these are the things that will help your child feel safe. Because if they know what is actually coming for that meal, because it's already been planned and discussed, if they know that they will be having a snack at a certain time, if they know that certain behaviour is not permitted and not allowed, and there may well be consequences, this will all help to keep your child feeling like they have got boundaries and there's a safe place for them, because there's not much room for manoeuvre. It also may well be helping them in terms of giving them some ammunition to help fight the bully that's in their head. Because if you say, no, you cannot do more than 5 minutes exercise today, that may well allow them to tell the bully in their head, bully, you may well want me to exercise until I can't stand up. But actually, my mum, my dad, my sister has told me I can only exercise for 5 minutes. It is a technique that may well work, it may well not, but it is really important still to have boundaries. You still have to parent, even though you're caring for someone who's very poorly. Marathon, not a sprint. So for parents, you really need to look after yourselves. You need as much resilience and robustness and energy as you can have. The saying, you can't pour from an empty cup, is so true. If you are trying to be compassionate to your child with the eating disorder, you have to be a role model and show that you can be compassionate to yourself and look after yourself. So it's really important that you have coping strategies for yourself. This is an illness that can tear families apart. If you think of an eating disorder as something like an octopus, and it's got its tentacles not only around your child, but you yourself, if you're the mum, if you're the dad, if you're the older sister, younger sister, that octopus has got its tentacles around all the family members and is trying to pull them away and separate out individual members, because the eating disorder doesn't like your child being supported, because the eating disorder or the bully knows that there's strength in numbers. So the more that the bully can isolate your child, and actually it can do it so easily, the amount of frustration that you will feel, it's really easy to actually allow that anger, that disappointment to get in between you and your child. And so the bully thinks, oh, yes, you see, look at that. Mum's angry now. Yes, so mum's not going to care for you so much. That's good. Sort of tick to the bully or the eating disorder. So that's why this focus on being calm and compassionate as much as you can is really important. You're not a robot, you're a human being. So even if you do it for 5 minutes a day, 5 minutes is better than not at all. And it's just about building up that approach to those meal times, to those times of heightened distress. One of the things that an eating disorder seems to do with parents and carers is almost to disempower them. And you have lots and lots of skills and have looked after your child successfully for 11, 12, 13, 14, 15, 16, 17 years. And yet something comes into your family, this eating disorder, and sometimes you feel like your power's been taken away. but by using skills in you that you have used in the past number of years in supporting your child, they're there. They've just been buried by fear and anxiety. So one of the things you can do is think of yourself as an emotional coach. When we're talking about eating disorders, we're really not talking about food. We're talking about emotions. And when someone isn't eating sufficient and they're not getting sufficient nutrition, what happens is they become emotionally numb. So any emotion that they were struggling with dealing with just goes away. So the process of restricting food is a strategy in itself, because those emotions that they don't know how to deal with or don't understand what they are no longer there. But this is not a strategy that is a strategy that a young person should be holding on to. So we need to look at other coping strategies. And one of them is for you as a family to talk about emotions. Having emotions is okay. We all have emotions. Young people struggle to articulate those emotions though. I'm frustrated. I'm really disappointed. And on top of that, you know what? I'm a bit sad. And someone will say, well, hang on, what's going on? I said, well, I'm angry because I've heard about what's going on in the NHS and that just makes my blood boil. But you know what? I'm going to talk to my MP about that. I'm disappointed because, would you know, again, Tesco's delivery was late and I've just paid extra for a guaranteed delivery slot. So I'm really disappointed. But I'm just going to go and write to the MD and say this isn't good enough. And you know what? I'm sad because I heard a bit of sad news the other day. So what I'm doing there is I'm saying it's okay to have emotions, and I'm actually describing and I'm validating and I'm labeling those emotions. And you know what? It's okay to be angry. It's just we need to make sure that that anger is regulated and the behaviour that follows is appropriate. So for your young person who there's this turmoil of emotions going on inside them, they don't know what to do. You being that emotional coach can really help them. Also, making them feel that it's okay to be able to talk about anything. And again, this is quite hard because we tend to, as parents, can tend to sort of go into a mode of interrogation. But one of the things to maybe focus on is just to actually ask open questions. Things so that, you know, how was your day, rather than was your day okay? Was your day okay? You'll get a yes or no answer. If you say, how was your day? That might open up a bit more of a dialogue that you can work on. So open questions, being an emotional coach are two things that are really important for you as parents and carers to follow. And also looking after yourself. There's another video that will talk about some of the other practical strategies that you can follow.